We heard a lot this morning and this afternoon for calls to action for the Cancer Moonshot to be involved. You have our commitment and our partnership to make significant progress.
The commitment to partner in Cancer Moonshot to do something in global collaborations is really, really important. I think that coming out of this, we want to have a more serious conversation about that. It's going to be really important. That's what the Global Health Academy Summit is really about. It's about collaboration, and I think that's a major come out, something that can come out from here with.
One of the clear aspirations of the Reignited Moonshot is to, as you know, reduce cancer mortality in the United States by half, at 50% over a period of 25 years.
Hello, my name is Vivian Kopsinger-Birchall, and I'm so excited to bring to you highlights from the recently concluded Global Health Catalyst Summit that was held at the Johns Hopkins Sibley Memorial Hospital in Washington, D.C. This year's theme was Cancer Moonshot, Advancing Collaborative Action for Global Health and Development. Among the people who attended was a representative from the President Biden's White House, or President Biden's administration, Dr. Catharine Young, who made a statement on behalf of the administration committing to working together with the Global Health Catalyst Summit to reduce cancer rates in the United States and across the world.
It's an honor to be here with you today, especially as someone for the first 18 years of their life called Sub-Saharan Africa my home. So yes, we really are everywhere. I want to start off where President Biden and the First Lady so often start, and that is with hope. I don't have to tell this crowd that we don't mean hope in the abstract form. We mean hope grounded in science, hope grounded in quality care, hope grounded in keeping families together, hope represented by every survivor around the world. And looking around this room today, seeing the collective commitment from so many countries to see impactful change happen, there is so much reason for hope. And that's why in February, President Biden reignited the Cancer Moonshot program to transform hope into action and set new goals. The first, to decrease the death rate by cancer by at least 50% over the next 25 years. The second, to improve the experience of people, their families, and caregivers through living with and surviving cancer. The Cancer Moonshot started back in 2016 when then Vice President Biden led an effort to double the rate of progress against cancer, a goal which so many, both here in the United States and across the globe, responded with passion, ingenuity, and commitment. The work he led in the final year of the Obama-Biden administration led to the launch of new programs, new policies, new collaborations across all sectors, actions that addressed from patient experiences from diagnosis all the way through survivorship. Globally, it led to the expansion of the International Cancer Proteogenomic Consortium at the National Cancer Institute, now spanning 14 countries and 33 member institutions. A network of leading cancer and proteogenomic research centers across the globe, increasing the diversity of people and cancers around the world. This consortium encourages cooperation and investments in cancer research and data dissemination, with its pledge to share data with all those that participate. Critical elements in advancing new innovations and treatments forward that we know need to be supported and scaled in sub-Saharan Africa. When now President Biden returned to office, he wanted to supercharge the work and bring his leadership and a whole-of-government effort back to the Cancer Moonshot. In addition to setting the new goals, the President identified areas of priority and focus. He has often said that he wants to end cancer as we know it. We took that statement and defined it specifically as we know cancer today. That too often a patient receives a diagnosis too late. That we have too little tools to prevent or do anything about it from the start. That we have stark inequities in diagnosis across to treatments and trials. That we know too little about how to target treatments to patients. That for cancers, we lack specific strategies, especially for those that are the deadliest, the rarest, and childhood cancers. That we leave most patients and caregivers to navigate the disease and its aftermath on their own. And that we don't learn enough from the experiences of patients. But these challenges are not unique to the United States. Certainly these challenges are merely amplified across countries around the world, and so the urgency to address them is paramount. We know that in sub-Saharan Africa, with a population exceeding 1.1 billion people, that without effective interventions, the number of deaths from cancer will exceed 1 million per year by the year 2030. This is not news to you, but this is unacceptable. To see real change happen, we must come together as one to tackle some of the greatest and shared priorities together. Our ability to strengthen international collaboration around key oncology elements like clinical trials, data sharing, and basic and translational research will accelerate new and innovative treatments for all cancer patients. Working across boundaries also means sharing best clinical and care practices, new ideas and innovations, and reaching more people with effective ways to treat, detect, and diagnose cancer to lessen the toll on human life. Many barriers remain, but there is no doubt that the future of oncology lies with global collaboration. Building strong partnerships and cooperations between countries like the United States and those in sub-Saharan Africa are key to overcoming them and making progress towards ending cancer as we know it. We've heard a lot this morning and this afternoon for calls to action for the Cancer Moonshot to be involved. You have our commitment and our partnership to make significant progress together. I'd like to say, I'm Bonnie Bashley. Thank you.
I hope you learned a little bit more about the history of the Cancer Moonshot and how it ties into the Global Health Catalyst Summit. Look out for more videos about the conversations that were held during this summit. Thank you for watching.